Combating the opioid crisis without using more drugs is the mission of pain relief centers. And here to discuss this further is Dr. Hector Casas. Welcome, doctor. How are you?
Thank you very much. Good morning.
We hear the opioid crisis. We've talked about it here on the show. It affects so many families out there. And to hear doctors who are trying to combat it, it's got to be one of the first steps. Why was this important to you in being able to establish your practice?
Because, we want to help patients at the end of the day. And we want to be part of the solution in the opioid crisis, not be part of the problem. And so one of the ways that we do this is by laser spine procedures that are at pain relief centers in Florida here. And so we have great feedback from patients undergoing these procedures, and these procedures last about a year, sometimes a year and a half, and patients keep coming back, knocking on our doors.
You know, I'm excited that we're diving into this because I think this information needs to get out there. One of the things that we've learned, though, when it does come to opioids, people do tend to think of orthopedics, and they do especially think of spine surgeries. Talk about what happened in the past that you were seeing, that you were like, you know what, no, this is a red flag. This is what I want to make sure and change.
Back in the day, a lot of part of the treatment for patients was pain medications, and not enough procedures were being done to address pain. And part of this problem is that patients got too many pain medications over many years. They got addicted to them over many years. And now the paradigm is shifting to reduce pain medications through spine procedures.
So it's actually the procedure itself. We're not necessarily just talking about that recovery time, which does that also impact it?
The recovery time after a procedure is always natural after any kind of surgery, whether it be minimally invasive or a major procedure, but that should not last more than 10 to 12 days or 14 days after that. But patients kept being on pain medicines for months and years after that.
Yes, and it seems like, too, when you do think about opioids and you think about pain management, my mind does always go to the back.
Correct.
Why is that? Well,
because that's where we see a lot of the back pain. Back pain is really where patients come in because they can't get out of bed, they can't get out of the chair, they can't go to work, they can't have an active life, as opposed to other areas in the body. So we tend to see a lot of back pain in our practice.
Opioids aside, what is it about this procedure? Because anytime, like you said, people do have surgery, maybe there's people at home saying it's easier for me to pop a pill versus having surgery. That's a very intimidating, very scary thing. Correct. Talk about the procedure to kind of ease people's minds and make them realize it's different.
The laser spine procedure is to address spinal arthritis joint pain, okay? And it's called mechanical back pain. It's coming from the facet joints in your lower back and the neck area. And like any joint, it can get arthritis over, as you age. And so what we do is we do a laser spine procedure through a minimally invasive, a small incision, less than a quarter inch long. We put a little cannula in there with the laser, and we kind of trim back the nerves that cause pain to the joints. And that reduces your pain, your joint pain, for about a year, sometimes a year and a half.
And like you said, though, that's still than being on pain pills for a year, which can have effects that you don't even want to leave the house.
It reduces your need for pain medications, increases your quality of life, your activity levels, and everybody's happy.
You addressed at the very beginning, and I want to kind of go back to it. You talked about the feedback you get from patients. I feel like that's so important. What do you hear? I'm sure you see those patients that are skeptical. Is this really going to work? Talk about what you're able to see.
Patients love it because they get a lot of patients do want to reduce pain medication. They want to be active. They want to be a father. They want to be a provider. They want to have fun. And so they all know that pain medicines is not a long-term solution. There's problems associated with it. And so these patients do extremely well over the long term. It's not a short-term benefit. It'll last about a year and a half, like I said. The nerves do grow back after we trim them, but it'll take a year to do so at least. And people knock on our doors every year. Hey, doc,
we're back.
We're back. Let's do it again.
Which that speaks volumes that you do have those repeat patients. Well, you know what? If you think that Dr. Casas could help you, of course, we have the website there on the bottom of your screen, and also right there on your screen. You can give them a call, visit their website. Again, Dr. Casas, we really appreciate you being here today and talking about this.
Thank you very much.
Keep up the good work, okay?
Thank you. Thank you.